Okay.
ഫാക്കൽറ്റി ഒരു 5 മിനിറ്റ് ചോദിച്ചിട്ടുണ്ട്. 5 മിനിറ്റ് കൊണ്ട് മീറ്റിംഗ് സ്റ്റാർട്ട് ചെയ്യാണ്. ഡിയർ ഫ്രണ്ട്സ്, ഇന്ന് യോഗത്തിന്റെ അധ്യക്ഷനാവേണ്ടിയിരുന്ന ഡോക്ടർ രാജേഷ് എത്തിയിട്ടില്ല. ഉടനെ തന്നെ ജോയിൻ ചെയ്യുന്ന അറിയിച്ചത്. അപ്പോൾ നമുക്ക് തൽക്കാലം സ്വാഗതം പറഞ്ഞുകൊണ്ട് ആരംഭിക്കുകയാണ്. സ്വാഗതം പറയുന്നതിന് വേണ്ടി ഡോക്ടർ ഐഷയെ ക്ഷണിച്ചോളൂ.
Good evening all. IHMA നോർത്ത് പറവൂരിന്റെ ഭാഗം പേരില് ഈ മീറ്റിംഗിൽ ജോയിൻ ചെയ്തിട്ടുള്ള എല്ലാ ഡോക്ടേഴ്സിനെയും ഞാൻ സ്വാഗതം ചെയ്യുന്നു. പ്രത്യേകമായി ഡോക്ടർ സന്ദീപ് ജോസ്, നമ്മുടെ ഫാക്കൽറ്റി. ഇതിനു മുമ്പും നമുക്ക് ഫീവറിന്റെ ഒരു സെഷൻ ഡോക്ടർ എടുത്തിരുന്നു. വളരെ യൂസ്ഫുൾ ആയിട്ടൊരു സെഷൻ ആയിരുന്നു. ഒരു ഓഫ്ലൈൻ ക്ലാസ്സും നമുക്ക് എടുത്തു തന്നിട്ടുണ്ട്. അപ്പൊ അതിന്റെ ഒരു കണ്ടിന്യൂഷൻ എന്നുള്ള രീതിയിലാണ്. ബട്ട് ന്യൂലി ജോയിൻ ആയിട്ടുള്ളവർക്കും ഉപകാരപ്പെടുന്ന രീതിയിലായിരിക്കുള്ളൂ ഡോക്ടറുടെ ക്ലാസ്. അപ്പോൾ ഡോക്ടറെയും ഞാൻ ഈ മീറ്റിംഗിലേക്ക് സ്വാഗതം ചെയ്യുന്നു. ഓക്കെ, താങ്ക് യു. സന്ദീപ് ഡോക്ടർ,
തുടങ്ങട്ടെ.
2-3 നോൺ കേരളൈറ്റ്സ് ഉണ്ട് കേട്ടോ, നമുക്ക് ജോയിൻ ആയിട്ടുണ്ട്.
ഞാൻ ഇംഗ്ലീഷിൽ സംസാരിക്കാം. ആർക്കെങ്കിലും പറയുന്നത് മനസ്സിലായില്ലെങ്കിൽ അപ്പൊ തന്നെ കൈപൊക്കി ചോദിക്കണേ. എന്റെ സ്ക്രീൻ കാണാൻ പറ്റുന്നുണ്ടോ?
ആ കാണുന്നുണ്ട് ഡോക്ടർ, വിസിബിൾ ആണ്.
വിസിബിൾ ആണ്. ഓക്കെ, ശരി. സ്റ്റാർട്ട് ചെയ്യട്ടെ എന്നാ. So good evening all. We have already covered the approach to finding the symptom in acute illnesses in the previous sessions. So I'm just going to give you a quick recap of the different methods we can use to find the symptom in acute illnesses. Okay. So the one method is using Dr. Vijaykar's thermal, thirst, activity, and speed axis. The second option is you can use ailments from the repertory, or if you know the materia medica very well, the ailments from which has precipitated the acute illness. And add to that your thirst and thermal axis. If that option is not also giving you the right remedy, you can go for repertorization. And in some cases, you can go for proven remedies. We'll cover all this in the coming session. So, if all are with me, I'm going ahead. So the golden rule we have to keep in mind is that whatever the objective of all these methods, except for the fourth, the objective of 1, 2, and 3 is we have to focus on the individualizing symptoms in the case and not on the disease symptoms. That will give us the remedy. So again, this approach, all this approach, these three, the crux of this approach is that we are going for a single remedy. Unlike the other option where, I still meet doctors who give, when there's a fever with rhinitis, a common, when you have a viral fever, you'll have running nose, you'll have cough, you'll have throat pain, you'll have fever. So recently I talked to one person, they said they will start with belladonna 1 and 2 doses, and then for rhinitis they'll add 1, the throat pain they'll add 1, so on and so forth. So that's a different way, that is up to each person. But here we are focusing on what we are talking about is finding the minimum, that is one remedy. Okay. So I'm going straight away, going to start with cases. Through the cases we will learn. So this is a case of a 6-year-old girl who came to me on the 8th of July. And she had fever, coming of fever, thirstlessness. Her requirement was fine, on and off. Wants her mother with her. I asked for the ailments, it is not available. So here, can you come up with a remedy? Can you suggest some remedy? Thirstless girl with fever. Sometimes it is there. The fan is at medium. Sometimes she's covering, sometimes she's not covering. Once, okay, yes, Dr. Nita, that is right. Pulsatilla was my prescription. Okay. So on the 8th, I give Pulsatilla. So let us see what happened. This is in the evening. Okay. So let us see what happened the next day. That is the 9th morning. 9th morning, the mother says, last night the temperature touched 103 once. then it is ranging between 99 to 100. And she is also complaining of giddiness. So what do you want to do? So you are the doctor here. What is your reading? Has your pulse settler worked or not? Any suggestions? If it has worked, why do you say it has worked? If it has not worked, why would you say it has not worked? Again, Dr. Dini, that is right. Because, okay, Dr. Samya says that yes, it is because there is an initial aggravation. True, there is an initial aggravation and then there is a temperature has come down. But like Dr. Dini pointed out, there is giddiness, which was not there yesterday. Okay. So giddiness is something to do with your sensorium. So that points to that something is not right. If along with your temperature coming down, if the girl was better in terms of energy, then we could have definitely said, yes, we could wait with pulse satellite. So what would you do? We will again see what are the symptoms available. So the symptoms available today are these. So the girl is weeping. There is offensive flatness. She's saying her head is big. When you ask about the thermals, the fan is slow, power is sometimes there, sometimes not there. So initially, the child was thirstless, now is thirsty. Desire for small quantities. She asked for strawberry. Now the mother says that prior to onset of fever, she remembers that the child, after playing, suddenly came and had a head bath. So that would be what? That would be you're suppressing your perspiration. You're with me, right? Okay, Dr. Rajesh is coming. Nice to know that. So we'll continue. Okay. So here, what would so the ninth morning, so what do we have? What are the symptoms we have? We have fever, which is continuing at 99 to 100. We have giddiness, plus we have what we see on the screen. So can you tell me what would be the individualizing symptoms in this case? What are the symptoms you would consider? Okay, that would be there. Head is big, right? Then what else? Weeping, big head, offensive flatus, weeping disposition, offensive flatus. Okay. In your opinion, what would be the thermal state? Is the child hot? Is the child chilly? So now, okay, Dr. Dini, you're saying is not, you've not understood exactly. You mean to say your thermal state is not clear? Okay, we'll leave it as that. Yes, we don't know about the thermal state. Right. We are a bit, it could be chilly, it could be hot. So that is the way even I went. She could be chilly, she could be hot. So I leave it at there. I also left it at there. So here now, what would be your approach? First, we went by the thermal, thirst, activity, speed axis, and we selected pulse settler. So here, what approach you would like to take? So what I did, I took a repertorial approach. And this is the totality I took. So there is thirst, and this thirst is specifically for small quantities. There is giddiness during fever, which is not very commonly seen, right? And I took two ailments from one is damp, rainy weather aggravation. So this is what I do now. Because many times patients do not recollect, they are not able to quickly recollect any specific ailments from. But you can look at the weather around you. So with the rainy weather, when the complaints come in, I take that as one ailment from, and specifically I also took suppressed, perspiration suppressed. I also took flatus offensive as well as the sensation of head is enlarged. So you have totally altogether 6 symptoms. Okay. And this is your repertorial chart. All right. Now, which remedy will you choose? Wait a minute, just 1 second. Hello, I'm taking a class right now for the doctor, so I'll get back to you later. We'll take 1 hour or more. Okay.
Okay, brother, no problem.
So in this case, the question is, how will you go about selecting the remedy? So let us go one by one. Would it be sulfur? And if you're saying no to sulfur, why? If you're saying yes to sulfur, why? Then you have bravina, you have arsenic, you have china, you have lycopodium, you have naxomica, you have silicea, you have belladonna, you have lactasis, you have rustox, you have natron. So how will you go about your? So this is where we start using your application of mind. Okay. So anything else which was there in the previous totality, so let me look at the picture. No polycrest may be present always while ripples. Okay, you're saying the polycrest usually comes up during repertorization. Dr. Soumya, that is okay, but I would not say where you should exclude because a polycrest is coming upon a repertorization. Because some remedies are often indicated. So it could be your polycrest. Weeping is not taken. Okay, you take weeping. You take weeping. So if you take weeping, what would you like to give? Because it is on weeping, you give pulse settler, no? So you take weeping, okay, you can consider weeping. Okay, I'll do one thing. I'll open my repertory and I will take up weeping. Let's see if that works. So I'm going to quickly repertorize for you. So let's start with the symptom not taken. Let's say weeping, tearful mood. Okay. We will take that. And we will go to stomach. We'll take thirst. Small quantities for. We will take generalities. We'll take weather. Weather. Damn wet aggravation. We will also take perspiration, suppressed, some rectum. Rectum we are going to take. Flatus, pensive, and we are going to take vertigo, fever during, and we are going to take heavy left out a head enlarged sensation. Enlarged sensation. So we have 7 symptoms. See, you have sulfur, bryonia, arsenic, china, lycopodium, axomica, silicea, belladonna, again, lachesis, rustox, natriumur. So adding that does not really help. So let us just go back. In this thing, is there anything that we missed? Is there any symptom that we missed? What about this? During this fever, she asked for this. Is this something you usually get? So now in this second day, what I gave her was China 200. Because China has a desire for fruits. So from the repertorial chart, it is not sulfur because sulfur would be definitely hot. Bryony will also be definitely hot. Arsenic, probably. China, probably. Lycopodium, again, definitely hot. Naxomica, again, probably. Silicea, probably. Rustox, probably. Belladonna would be much faster development. Faster. Natriumur, again, specifically hot. So, this girl, so I was thinking, so we have arsenic, China, Naxomica, Silicea, and Rustox. Now, this is how I think. I'm just sharing you how I approach cases. Okay. So then from this, okay, who would of these 3 remedies, arsenic, China, Naxomica, and Rustox, which of them would ask for a fruit while having fever? So the obvious choice is, for me, is China. Now, did China help? Let's see. If someone can mute their mic, that will be helpful. So again, we are sticking with day 1. Morning, I gave China. Day 2, afternoon, same day afternoon, I am asking her to report back. Now, the situation is not better in any way. There is delirium. So I have now delirium is that now the child is delirious by afternoon. Okay. So what do you want to do? Do you want to continue with your remedy or do you want to refer now? Do you want to continue with your homeopathic medicine or do you want to refer the case to the hospital? So I went back to the repertorial chart and I selected arsenic cal, considering the delirium. Evening again, they call up, okay? But the fever is saying so is the delirium. Now, what do you do? So again, so in such cases, don't lose hope, don't lose your confidence. You again apply your mind to the totality that is there. So I can ask, what all are there? The child has headache, myalgia. She wants light. She's definitely chilly. The thirst for small quantities is being there. Now, what else? Now, this is a consultation of the phone. No, the mother is not in a position to bring the child over to your clinic. So, what else can you ask over the phone? And remember the remedies you have. You have already given child, you have already given arsenic. You have silicea, you have naxomica, you have rustox left. Okay. What else can be asked over the phone? In this case, what I did, I asked her to send a picture of the tongue. And this is the picture that came. So now, do you have your remedy? Would anyone like to suggest? What is this tongue? To which remedy does this tongue belong? Yes, Dr. Sari, everyone. Yeah, everyone is getting it. Rustox. It is rustox. And what happens when the right remedy goes in? The next day, that is third day morning, there is no fever, there is no delirium, there is no headache. So additional reference I took was delirium fever during that was taken on basis which arsenic cal was given. So we can add delirium fever during and see what are the remedies we have. To this we can add delirium fever during. Delirium fever during. Take that. You still have your remedies. You have arsenic, you have china, which you already given, you have naxomica, rustox. Silicea is out. So of your chili remedies, you've already given china and arsenic. Does not work. You have naxomica and rustox, and the tongue has helped you to decide in favor of rustox, and the rustox works. So that is the speed of the remedy. So your remedy, so what I do in practice is like I asked on the second day, I asked the mother to report every 4 hours. So the speed of your remedy is right, within 4 hours, you start getting the results. So if not, I change the remedy. Okay. So the crux of the what one learning we have in this case is apart from remedy differentiation is even when under pressure, keep your focus intact. Keep on looking for that individualized symptom. Sometimes it might be something you have missed. Because I missed because it's over the phone. So I was thinking, what did I miss? So then I thought about, okay, I've not seen the child's tongue. So I asked for the photograph of the child's tongue, and that helped me clinch the case. Okay. So far, any doubts? ആർക്കെങ്കിലും പറഞ്ഞത് മനസ്സിലാകുന്നുണ്ടെങ്കിൽ ചോദിച്ചോളൂ ഞാൻ ഒന്ന് വിശദീകരിച്ചു തരാം.
Some are asking for the repetition and potency.
Potency is 200. Repetition single dose. If more than that is some in this current season, in some cases I've repeated the second time, but further repetition has not been required so far. Usually within the second dose, the case is completely resolved. The second dose has been given usually only after 24 hours if still the germs are better, but the disease is still not completely gone. In this particular case of this girl, all the doses have been single doses, right? From China, morning is like day 2 morning is China, day 2 afternoon arsenic, single dose, 200 single dose. Evening, no change, rest of single dose. Next day morning, things are better. So shall I move ahead? This is clear?
ഡോക്ടർ ഡൗട്ട് ചോദിച്ചോട്ടെ?
ആ,
നമ്മള് ഫസ്റ്റ് ടൈം വന്നപ്പോ ടങ്ക് നോക്കിയിട്ടില്ലായിരുന്നു കുട്ടിയുടെ?
ഇല്ല, ഫസ്റ്റ് ടൈം തൊട്ട് ഈ കേസ് ഓവർ ദ ഫോണാണ്.
ഓക്കെ.
തുടക്കം മുതലേ കേസ് ഓവർ ദ ഫോണാണ്. എനിക്ക് വന്നില്ല.
നമ്മൾ ടങ്ക് ഇപ്പൊ ആ സമയത്ത് നോക്കിയായിരുന്നെങ്കിൽ ഇങ്ങനത്തെ ഒരു സൈൻ ആദ്യം കിട്ടാൻ ചാൻസ് ഉണ്ടാ?
പിന്നെ തീർച്ചയായിട്ടും
ഓക്കെ.
ടങ് നോക്കിയിരുന്നെങ്കിൽ നമുക്ക് അന്ന് ചിലപ്പം ചില കേസുകൾ നമുക്ക് ആ സമയത്ത് ഈ ടങ് കിട്ടിയിരുന്നെങ്കിൽ നമുക്ക് അത് ക്ലിക്ക് ആയനെ.
ഓക്കെ.
ചിലപ്പം ആ സമയത്ത് ഉണ്ടായിക്കാണോ നെക്സ്റ്റ് ഡേ ആയിരിക്കും ഉണ്ടായിക്കാണോ, അങ്ങനെ വരാം.
സർ, ഒരു ഡൗട്ട് ഉണ്ടായിരുന്നു.
ആ
സർ, ഇങ്ങനെ ഒരു കേസ് വരുമ്പം നമ്മൾ എങ്ങനെയാണ് ഇത്രയും മെഡിസിൻസ് അവരെ കയ്യിൽ കൊടുത്തു വിടുക? എങ്ങനെയാണ് അത് നമ്മൾ ഹാൻഡിൽ ചെയ്യുന്നത്? ഇങ്ങനെ
ആ ഒരു ഓപ്ഷൻ ചിന്തിക്കാൻ നമ്മൾ എന്ത് ചെയ്യുന്നത് വെച്ചാൽ, യൂഷ്വലി ഇതിപ്പം ഞാനൊരു എനിക്ക് കുറച്ച് ഇങ്ങനെ കുറച്ച് ചാലഞ്ചിങ് ആയിട്ടുള്ള സിമ്പിൾ ആയിട്ടുള്ള കേസസ് അല്ല ഞാൻ ഈ പ്രാവശ്യം ഇടുന്നത്. കുറച്ചധികം വർക്ക് ചെയ്യണമെന്ന കേസുകളാണ് ഞാൻ കാണിച്ചു തരുന്നത്. അപ്പൊ നമുക്ക് എങ്ങനെ, അല്ലെങ്കിൽ ഇപ്പൊ എനിക്കൊരു ഡൗട്ട് ഉണ്ട്, ഇതല്ലെങ്കിൽ മറ്റേത് ഡൗട്ട് ആണെങ്കിൽ യൂഷ്വലി ഞാൻ ചിലപ്പം 2 മരുന്ന് കൊടുത്തോളൂ, അല്ലെങ്കിൽ 2 or 3 മരുന്ന് മാക്സിമം. ഇപ്പൊ കഴിഞ്ഞ ദിവസം ഒരു കേസ് വന്നു, എനിക്കൊരു സംശയം ഉണ്ടായിരുന്നു, യൂപ്പറ്റോറിയം ആയിരിക്കും ആർസനിക്കാൽവ് ആയിരിക്കും എന്ന് സംശയം ഉണ്ടായിരുന്നു. പക്ഷെ സ്ട്രോങ് ഹെഡേക്ക് ഉള്ളതുകൊണ്ട് എനിക്ക് യൂപ്പറ്റോറിയം ഭയങ്കര വീക്ക്നെസ് ഉണ്ടായിരുന്നു, ഫീവർ ഉണ്ടായിരുന്നു, സ്ട്രോങ് ഹെഡേക്ക് ഉണ്ടായിരുന്നു, അപ്പം തേഴ്സ്റ്റ് എല്ലാം ഉണ്ടായിരുന്നു. അപ്പൊ ഞാൻ ആ കേസ് റിപ്പോർട്ടുകൾ റെഫറൻസ് കഴിഞ്ഞപ്പോൾ യൂപ്പറ്റോറിയവും ആർസനിക്കും ക്ലോസ് ആയിട്ട് വന്നു. കൂടുതൽ ഇരുന്ന് ചോദിച്ച് കഴിഞ്ഞെടുത്താൽ കുറച്ചും കൂടെ ടൈം ഒക്കെ സ്പെൻഡ് ചെയ്താൽ ഇത് രണ്ടും ഡിഫറൻഷിയേറ്റ് ചെയ്യാൻ പറ്റും. എനിക്ക് സമയത്തിന്റെ ഒരു പരിമിതി ഉണ്ടായിരുന്നു. അപ്പൊ ഞാൻ എന്ത് ചെയ്യും, ചിലപ്പോൾ നമ്മൾ ഒരു അസുഖമുള്ള പേഷ്യന്റ് കൂടുതൽ ഇങ്ങനെ കണ്ടുമാനം ചോദിക്കുമ്പോൾ പേഷ്യന്റും മുഷിയില്ല, നമുക്കൊരു 2 or 3 മിനിറ്റ് കൊണ്ട് നമ്മൾ കാര്യങ്ങളൊക്കെ മനസ്സിലാക്കിയെടുക്കും. അപ്പൊ അങ്ങനെ വരുമ്പോൾ ഞാൻ ഈ കേസിൽ യൂപ്പറ്റോറിയം കൊടുത്തു, ആർസനിക് ആൽബം കൊടുത്തു. അപ്പൊ യൂപ്പറ്റോറിയം ഒരു ഡോസ് കൊടുത്തിട്ട് 4 മണിക്കൂർ കഴിയുമ്പോൾ വിവരം പറയാൻ പറഞ്ഞു. ആ ബെറ്റർ ആയപ്പോൾ പിന്നെ അത് കണ്ടിന്യൂ ചെയ്യും. അങ്ങനെ അതാണ് യൂഷ്വലി ഒരു ഓപ്ഷൻ. ചിലപ്പോൾ 3 റെമഡീസ് സംശയം ഉണ്ടെങ്കിൽ 3 റെമഡീസും ഈ 2 ഡോസ് വെച്ച് കൊടുത്തു വിടുക. പക്ഷെ എവിടെ ഈ തെർമൽസിലൊക്കെ ഞാൻ എപ്പോഴും മാക്സിമം ഞാൻ അത് നമ്മളെ ഹെൽപ്പ് ചെയ്യുന്നു. ഇപ്പം ഇവിടെ നമുക്ക് 6 റെമഡീസ് ഉണ്ടായിരുന്നു, സൾഫർ നാട്രിയം ഇതൊക്കെ. അപ്പൊ അതിൽ നമുക്ക് തെർമൽസ് ഹെൽപ്പ് ചെയ്യും നാരോ ഡൗൺ ചെയ്യാൻ. പിന്നെ ഇതുപോലെ നമുക്കൊരു 5 ചില്ലി റെമഡീസ് ഉണ്ടായിരുന്നു. അപ്പൊ അതിൽ നമുക്ക് എന്ത് ചെയ്യാം, നമ്മളുടെ ഈ മെറ്റീരിയൽ മെഡിക്കൽ റെഫറൻസ് ഇപ്പം യൂഷ്വലി വെറ്റ് വെതർ അഗ്രിവേഷൻ കൂടുതൽ ഏതാണെന്നുള്ളത് നോക്കി നമുക്ക് ഇപ്പൊ സൈലീഷ് അത്ര അങ്ങനെ ഇൻഡിക്കേറ്റർ. സൈലീഷ്യ വരുമ്പം യൂഷ്വലി പഠിക്കാൻ താല്പര്യം ഉണ്ടാവും. അപ്പം സൈലീഷൊക്കെ നമുക്ക് അങ്ങനെ തന്നെ അങ്ങോട്ട് മാറ്റിക്കളയാം. പിന്നെ വരുന്നത് ഈ ചൈന വേണോ ആർസനിക് വേണോ അങ്ങനെയൊക്കെയുള്ള കാര്യങ്ങൾ ചിന്തിക്കേണ്ട കാര്യങ്ങൾ. ആർസനിക് ഒക്കെ യൂഷ്വലി നമ്മൾ കുറച്ചുകൂടെ ഫാസ്റ്റ് ആയിട്ട് ഡെവലപ്മെന്റ് കാണും. അപ്പൊ അതാണ് ഇനീഷ്യലി ആർസനിക് കുറിച്ച് ചിന്തിക്കാഞ്ഞത്, കുറച്ച് ഗ്രാജുവൽ ഡെവലപ്മെന്റ് ആയിരുന്നു. അപ്പം ഇവിടുന്ന് നമ്മൾ പഠിക്കുന്ന എനിക്ക് I'll just repeat what Dr. Nasiba was asking. So sorry, Dr. Lekha was asking. So here she was asking, so how will you give more than, you are yet to decide between 2 to 3 remedies, and how will you practically do it? So what I do is that practically you usually narrow down to 2 remedies and I'll give both of them and I'll ask them to take the first remedy of choice. If that is not working within 4 hours, you change the second remedy. Again, something what I would like to emphasize is, if you go to an allopathic hospital, I have cases here, you would have also cases, no fever comes down, usually does not come down before 5 days. Many people are admitted for at least 3 to 4 days before they are out of the hospital. So don't have any qualms about changing the remedy. If one is not working, if you able to give a result within 1 day or the second day, it's very good job. There's no doubt about it. Okay. So again, coming back to the point. So here, the question was we had from the repertorial chart, we had about 6 to 7 remedies. So when we take out the hot remedies, we narrow down to the chilly remedies. From that, your knowledge of the materia medica will help you to again further narrow it down. So depending on like, since I am here working in the city, so what I do is if I give 2 remedies, if that is not helping out, because there is facilities like Swiggy and things like that, people easily can get the remedies. So that within a matter of few hours, the medicine is with them. But if you, depending upon your circumstance and the place where you're working, if necessary, you give more than few remedies. Okay, so that is not a big deal. Practically speaking, if you have like in my cases, what I'm showing you today is cases which have, because earlier I had shown you a lot of simple cases. So this time I'm showing you cases where we are applying more options. We are persevering with the case in spite of challenges. So in my practice, because I have more of chronic patients, I actually have less time to sit and spend more time with my acute patients. So I do things a bit quick. Okay. Is that clear?
Yes, sir.
Okay. Okay. So that was case, that was it. Okay, sorry. Next. So that was the first case. Okay, now we'll go to the second case. This is a This is a 33-year-old lady. Now she came to me for what? She did not come to me for fever. She came to me. She took some allopathic medicines for fever. Okay, for 3 to 4 days. The last 3 to 4 days, she was taking allopathic medicines for fever. And now see what is her state. After 3 to 4 days of allopathic medicine, she still got a bad cough. She still got body pain. She has giddiness on standing. The pain is so bad, she's restless and she's sensitive to touch. And today she's chilly and thirsty. So this is one example of seeing, just to show to you what the allopathic medicine leaves the patient with at the end of their treatment. And if you just go back for previous case, where when after the right remedy, within 12 hours, the generals as well as the symptoms, the symptoms of the generals as well as the disease is better. Now see the result of the allopathic treatment. The fever is gone, but the generals are still bad. So quickly, can you solve this case? What would you like to do? Okay, Dr. Abida has given an opinion. Anybody else? Dr. Abida, could you justify why you wanted to give Rostox? Okay, Dr. Neetu said it's China. Chile allergy. Okay, fair enough. So even I also thought in the same direction. I also gave her Rostox. Okay, fair enough. So next day, the report is yesterday she had giddiness that aggravated, got better, myalgia, relatively better, but not, vertigo is almost gone. Her restlessness is also almost gone. Her cough is much better. Myalgia is still lingering, but today there's a new symptom. So what is your opinion? So where is the case going? What is your opinion? So how would you factor in the sensitiveness to smell? So what has happened to the smell is one of your sense, right? So that has become more exaggerated. So in this case, this day to morning, okay. So I did not, even I was a bit, so see, now a lot of journals are better. The cough, which is a specific symptom, that's also better, but something new has come up day to morning. So here I did not prescribe, I waited. So when there is a slight element of confusion, your approach should be wait. Okay. By noon, she says there is a lot of weakness also. So now, any doubt whether we have to change the remedy or not? Okay, in between somebody said it is palliation. Yes, it is. Yes, probably it is palliation. So that is what has happened. But at that point of time, I was a little bit in doubt whether it is palliation or not. So the new symptom has come up. So in the such cases, I would wait for a few hours to see whether it will go off or what is happening, what is developing, whether further symptoms are going to develop or not. So as we rightly read, it was a partially similar remedy. Rastat was a partially similar remedy, and by afternoon weakness became quite strong, and so there is no doubt we have to prescribe. So what would you like to prescribe now? So you have in addition, so this is a chilly, thirsty person who was very restless. And when it comes to restlessness, it can be either mental restlessness or physical restlessness. But when she first gave her symptom, the suggestion was that she was restless out of the pain. So pointing more towards a kind of physical restlessness. This is again over the phone, right? So if it is physical restlessness, we go for Rustox. Rustox is partially similar. So the restlessness was mental. So what is your remedy? Right. Arsenic, right. So you see, so this is how we sort things out, right? Arsenic, right? So are you getting the way we can think around a situation, right? You don't totally discard you're not totally discarding our first totality. But we are seeing that, okay, their understanding of the restlessness was not correct in the first place. So we change and we give the second remedy, and with the second remedy, so I took this reference point also, mind sensitive, oversensitive to orders, and that also helps. So I will just see the repertory. We'll see the repertory for that. So these are also options you can use. This is how you can work around cases. Mind sensitive, oversensitive, orders. See arsenic coming up in a very bold manner. Do we have Rustox here? Rustox is not here. So that is also a clinching factor to select your arsenic. Okay. So at this point, would you rest your case or you want to prescribe further? What is your call? So this is case 2, you're given arsenic the day before, right? Day 2 noon you gave arsenic. Day 3 evening you're getting a phone call saying taste was bitter yesterday and the bitterness much better, appetite is better. I have slight nausea, slight giddiness, slight weakness. Yesterday weakness was 3 marks. Today weakness is 1 mark. So what do you want to do? You want to do something? What is your opinion? So many are of opinion wait. So I am also of the same opinion. So I think now we are all getting into the same line of thought. Yes, because most of the journals are better, including the taste is better. Police, the symptoms, the specific symptoms are better, but just 1 plus. She recovered. I did not prescribe anything further. The next day she was okay. So again, you see what is, again, if you can appreciate what our remedy does, the way our remedy helps compared to the allopathic remedy. This is, so I'm moving on to the third case. Before I move on, any doubts with the second case? Just give me 1 minute. So the second case was okay? No doubt, okay, moving on. Thank you. So the third case, okay? This is a 12-year-old boy. So on July 8th, 8 a.m., he's saying, I have throat pain since morning. So what was the ailments from? 2 days ago, he had a cold drink. And he's chilly and thirstless. There is slight weakness and no interest to go to school. So in this case, what approach would you like to take? Like you have thermals, thirst axis, you have repertorization, you have ailments from, what would you like to take? ailments from. Somebody suggested hepat. Okay, ailments from. Okay. So let's take ailments from cold drinks, right? So okay. So let us see what any remedy suggestions. So I'll show you. I'll open the repertoire and show you ailments from cold drinks. Generalities. Food. Cold drinks, aggravation, right? So the full symptom is 4 mark remedies. I'm going to read out slowly. You have aconite, antimonium crudum, arsenic, bryonia, calcareca,
എനിക്ക്
calcareous.
ഉണ്ട് വാ എനിക്ക് എനിക്ക് മുത്തേ നീ നോക്കൊന്നും വേണ്ട
Chamanti.
മുത്തേ എനിക്ക് എനിക്ക് ചോറ് കിടന്നോണ്ട് ഉണ്ണാൻ പാടില്ല എനിക്ക് എവിടെ ഉറക്കം വരുന്നത് ഞാൻ ഇപ്പൊ ബ്ലാഡാനിക്ക് വെച്ചെന്ന് നീ 12 മണി വരെ ഇരിക്കൂലോ
ആരുടെ മയക്കമാണ്?
എനിക്ക് മുത്തേ
ഡോക്ടറിന്റെ മയക്കമാണ്.
വെറുതെ
ഡോക്ടർ പ്ലീസ് മ്യൂട്ട്
പോക്കറി
ചെയ്യൂ.
കാണിക്കരുത് കേട്ടോ എനിക്ക്
രേഷ്മി ഡോക്ടർ പ്ലീസ് മ്യൂട്ട് ചെയ്യൂ. ഓക്കെ. നമ്മള് എവിടെയായിരുന്നു? So see, you have so many remedies. So which will you choose? So okay, I will help you. So ailments from cold drinks. Patient is chilly, thirstless. No interest to go to school. Any suggestions? If you want, I'll read out all the chilly 4-mark remedies. Okay. Aconite, arsenic, calcareca, china, perum, hepar, calica, muxol, naxomica, Serenum, Rostock, Sepia, Silesia, Staphysagria, Veratrum. So you have so many remedies to choose from. So how will you choose your remedy? So what is that? What is the method you're going to use, adopt? So in this case, I gave this boy Sepia. Okay. I took the totality chart. The axis, thermal thirst axis. The child is chilly, thirstless, dull, not interested to go to school, plus ailments from remedy. So I gave this boy Sepia. Okay. This is on day 1, 8 a.m. Now day 1 afternoon. That is after at 1 p.m. there was no change. So here, now what is the speed of the development in this case? I'll just go back. Okay. The ailments from was 2 days back, right? And this morning the throat pain has started. So what is the speed? Definitely slow, right? So I applied that also. When I look up the repertorial remedies, I did not go for arsenic, belladonna, which will have hepat, they develop quickly. Are you with me? Or any doubt with that? Slow, yes. Okay. So that is how I went about. So second day, I gave dulcamera 200. No, not second day. First day, same day, I gave dulcamera 200. We will come to dulcamera later on. Okay, so here I'm not explaining to you why I gave dulcamera, because we will take up dulcamera after a few more cases. So after dulcamera, this is day 1, 9 p.m. Okay, evening. There is the child was a lot of sneezing after dulcamera, but weakness and throat pain is same. So is the patient better? I think by now all will be on board saying that the patient is not better. Although Sneezing is a good sign. If your throat pain is there, once the throat pain goes, and if you have sneezing, it's a good sign. But if the weakness is persisting along with the throat pain, then the patient is not better. So, should we wait or change the remedy? We of course have to change the remedy. And here the chart has not helped, isn't it? So what is the alternative? So let us go back. So this is the data we have. This is the data we have. There's nothing else, no other data. So now the thermal thrust axis speed approach plus Ihma from using the chart, we came to sepia. It has not helped. So now what is the option? Now we can, okay, let us think about repetition. So, but what is the rubric we are going to take? So what is that catches your attention? What is, in other words, I'm asking, no, what is so individualistic? What is peculiar? What is striking about this case? You have chili, you have thirsters, fine. You have ailments from cold drinks, you have taken that. What else? So again, let us come back to the speed. The child took a cold drink 2 days ago. And the pain is starting today, 48 hours later. So the speed is slow, but it is very slow, right? Are you with me? It is absolutely slow. What rubric can you think about? So I looked at the record. So the word that came to my mind is insidious. So I searched for insidious in the record. And I took, so the ailments from there is there, and I took insidious. This is the rubric that I got. Insidious fever. So although there is no fever, because it is a throat, it is an inflammation. So I took this rubric of insidious fever. And what do we have? We have again, surprisingly, we have arsenic, China, cocculus, sulfur, merc salt, tuberculina, Sequel core. So only Sequel core, conium, tuberculum, merc salt, sulfur. Only 1, 2, 3, 4, 5, 6. Only 7 remedies cover the 2 rubrics. So this was something of a learning for me also. Correct? Arsenic, tuberculum, merc salt, all slow, very slow. Capable of very slow pathogenesis also. China, of course, I knew. Sulfur, I always consider it can be either slow or fast. That was also there in my mind. But arsenic, merc, tuberculum was a learning for me. So now the learning is over. So we are coming back to the question. Now, which of these remedies are you going to choose? And what is the question that you are going to ask? This is the chart in front of you. So can you help me in what? Now you have to differentiate, no? So what is the question that you want to ask? This is the chart again. So let us go back to the chart, okay? We'll go back to the repertorial chart. So I thought about arsenic, China. Sulfur was not, I wrote out sulfur and tuberculum because they are hot remedies. Cocculus, I don't know cocculus. Conium, okay, conium can be very slow. So coming to think about throat. So This child does not have fever. The only thing is the throat pain and weakness. So I asked him about the salivation in the mouth. And he said there is more saliva. So now you got the remedy? So if there's more salivation, what would your remedy be? Yes, yes. We have come up with the right remedy. The remedy is mug salt. With mug salt 200, one dose. Again, 200, one dose. Case salt. Next day, boy goes to school. Case 4. Now,
ഡോക്ടറെ എക്സ്ക്യൂസ് മീ,
this lady.
ഡോക്ടർ ഒരു ഡൗട്ട് ഉണ്ട്.
എന്തോ?
ഒരു ഡൗട്ട് ഉണ്ട് ഡോക്ടറെ. കഴിഞ്ഞ കേസിലെ കേസ് 3 മെർക്സോൾ സെലക്ട് ചെയ്തില്ലേ? ഹലോ,
ഏത് സെലക്ട് ചെയ്തു?
കേസ് 3 കേൾക്കാൻ പറ്റുന്നുണ്ടോ ഡോക്ടർ? മെർക്സോൾ സെലക്ട് ചെയ്തില്ലേ?
ഒരു മിനിറ്റ്, കേസ് 3ലേക്ക് പോട്ടെ. അതില്
മെർക്സോൾ സെലക്ട് ചെയ്തത് സലൈവേഷൻ വെച്ച് മെർക്സോൾ.
അല്ലേ സെലക്ട് ചെയ്യുന്നത്? അതെ, കറക്റ്റ്.
ഡോക്ടർ ഒരു ഡൗട്ട്, ഈ നമ്മുടെ സോർ ത്രോട്ട് വരുമ്പേ സാധാരണ ഫുഡ് നമുക്ക് ഇറക്കാൻ സോളോയും ബുദ്ധിമുട്ടുള്ളപ്പോ സലൈവേഷൻ നാച്ചുറലി കൂടാറില്ലേ?
നമുക്കത് എക്സ്പെക്ട് ചെയ്യാം. പക്ഷെ ഞാൻ ഈ കേസ് ഇതെന്റെ മോന്റെ ആണേ. അപ്പം ഇവന് നേരത്തെ ഈ ത്രോട്ട് പെയിൻ വന്നിട്ടുണ്ട്. അപ്പൊ ഞാൻ ഇവന് സെപ്യ കൊടുക്കാനുള്ള കാരണം എന്ന് പറയുമോ, നേരത്തെ ഇവന് സെപ്യയിൽ ഇമ്പ്രൂവ് ചെയ്തിട്ടുണ്ട്. പക്ഷെ ആ സമയത്തൊന്നും ഇവന് ഈ സലൈവേഷൻ ഉണ്ടായില്ല. ഇവന് നേരത്തെ ഒരിടയ്ക്ക് ഒരു നാട്രമ്യൂളിൽ ഇമ്പ്രൂവ് ഉണ്ട്. അപ്പൊ ഒക്കെ ഇവന് ഈ ലിപ്സിന്റെ ഡ്രൈനെസ് വരുമായിരുന്നു, ലോവർ ലിപ് ഡ്രൈനെസ് വരുമായിരുന്നു. അപ്പൊ ഓൾവേസ് ഇതിന് ശേഷം ഇവന് വീണ്ടും ത്രോട്ട് പെയിൻ വന്നു. അപ്പൊ ഞാൻ ചോദിച്ചപ്പോ ഇവന് സലൈവേഷൻ ഇല്ല. അപ്പൊ ഇവൻ വേറെ റെമഡിയിലാണ് ഇമ്പ്രൂവ്. അപ്പൊ സലൈവേഷൻ എപ്പോഴും നമുക്ക് അങ്ങനെ ചിന്തിക്കാം, യൂഷ്വലി നമുക്ക് അങ്ങനെ ചിന്തിക്കാം. ബട്ട് എന്റെ പ്രാക്ടീസ് ഇറ്റ് ഇസ് നോട്ട് ഓൾവേസ് ട്രൂ. ഇത് ഈ ത്രോട്ട് പെയിൻ ഉണ്ടല്ലോ, ഇത് ടോൺസിൽസ് അല്ല, ഇത് വലിയ ത്രോട്ട് പെയിനും അല്ല, സിവിയർ ത്രോട്ട് പെയിൻ. നമ്മൾ ടോൺസിൽസ് ഒക്കെ എനിക്ക് നല്ല ത്രോട്ട് പെയിൻ ആകുമ്പോൾ ഓക്കെ സലൈവ ഇറക്കാൻ പറ്റില്ല, അതുകൊണ്ട് സലൈവേഷൻ. ഇത് കാര്യമായിട്ടുള്ള ഇവിടെ ഒരു 1+ ത്രോട്ട് പെയിൻ ഒക്കെ ഉള്ള ആൾക്ക് സിവിയർ ത്രോട്ട് പെയിൻ. ത്രോട്ട് പെയിൻ ഉള്ള കേസുകളിലൊക്കെ സലൈവേഷൻ ഇൻക്രീസ് ആവണമെന്നില്ല കേട്ടോ, എന്റെ പ്രാക്ടീസ്. ഇവന്റെ കേസ് ഞാൻ കണ്ടിട്ടുണ്ട്. ഇവന് ചിലപ്പോൾ സെപ്യ, ഇവന്റെ 2-3 റെമഡീസ് ഇവന് വരാറുണ്ട്. സെപ്യ വരാറുണ്ട്, നാട്രമ്യൂർ വരാറുണ്ട്. ഈ ഇടയ്ക്കാണ് അവന് മെർക്സോളാൻ പോകുന്നത്. അതിന് മുമ്പൊക്കെ സാധാരണ സെപ്യയിലാണ് ഇപ്പോൾ അക്യൂട്ട്. അവനിങ്ങനെ പതുക്കെ സിംറ്റംസ് ഡെവലപ്പ് ചെയ്യും. മിക്കപ്പോഴും അങ്ങനെയാണ്, പതുക്കെ സ്റ്റാർട്ട് ചെയ്ത് വളരെ സ്ലോ ആയിട്ട് സ്റ്റാർട്ട് ചെയ്യും. ഈ കേസ് വന്നപ്പോഴാണ് എനിക്ക് ഇത് വേറെ സിംറ്റംസ് ഒന്നുമില്ല. ഇവിടെ ഈ കേസിലൊരു ചലഞ്ച് എന്ന് വെച്ചാൽ നമുക്കുണ്ടാവും. ഈ കേസിലൊരു ചലഞ്ച് എന്ന് വെച്ചാൽ ഇത്രയേ ഉള്ളൂ. ചില്ലി തേഴ്സ്ലെസ്, നമുക്ക് ഇഷ്ടമുള്ള റെമഡീസ് ഉണ്ട്. ചില്ലി തേഴ്സ്ലെസ്, ചെറിയ ക്ഷീണം, തൊണ്ടവേദന, കോൾഡ് ഡ്രിങ്ക്സ് 2 days ago, ഇതൊക്കെ ഉള്ളു. വേറെ ഒന്നും ഇല്ല നമ്മുടെ. അപ്പൊ വേറെ എത്ര ചോദിച്ചാൽ വേറെ സിംറ്റംസ് ഒന്നും കിട്ടുന്നില്ല. അപ്പോൾ അങ്ങനെ വന്നപ്പോ ഇവിടെ നമ്മൾ ഈ കേസിനകത്ത് നമ്മൾ ഡോക്ടർ പറഞ്ഞ പോയിന്റ് ചിന്തിക്കാം. ബട്ട് എല്ലാ കേസിലും നമുക്ക് സലൈവേഷൻ കിട്ടൂല കേട്ടോ. മുന്നോട്ട് പോട്ടെ. ഈ കേസിൽ എൻ്റെ ലേണിംഗ് ആ റൂബ്രിക്കാണ്, ഇൻസിഡൻസ് ഫീവർ. അതിനകത്തപ്പം ഇവിടെ ഞാൻ പറയുന്നത് നമ്മളുടെ ഇങ്ങനെ ഇവിടെ നമ്മുടെ തിങ്കിങ് പ്രോസസ്സ് ചേഞ്ച് ചെയ്യുന്നില്ല. അതാണ് what I want to emphasize is, see, when faced with a challenge, we are not quickly leaving this option and going to specifics or a tissue remedy or giving multiple remedies. we are trying to find again, focusing on, like we said, the core is trying to keep our focus on finding out the individualist remedy and using the tools we have in hand. What are the tools? Either it is the materia medica or the repertory or our practical knowledge. So here, the case, what when we face a challenge of, how to go further, we used a new rubric, and that new rubric not only broke the case, but also opened our insight, furthered our insight into aspects of arsenic and merksol. A different aspect of arsenic, merksol, and tuberculinum also. So this is how we can evolve. I'm showing you that is, as practitioners, when we persevere, I'm not saying that we should only follow Dr. Vijayakar or only somebody else, but the point I'm trying to emphasize again and again is that single remedy works, as taught by Dr. Hanneman, as he discovered. Single remedy works, minimum dose works, but our understanding about remedies will get sharper and evolve over a period of time with experience and this thing. So, like sharing like this, even if you might have, you people also would have insights into different aspects of remedies. So, sharing between professionals like us will all help each other. That is my point. So, we do not leave the core, like I taught, like I believe, I practice and I teach. Unlike allopathy, which has just one or two principles, we have a core set of 4 to 5 principles, including minimum dose, regarding repetition, to assess whether the remedy is right or wrong. So we have such core set of principles which, if we understand and use in our practice, will give results very faster than allopathics, and also a better, qualitatively better, as we learned in the case of the lady who came after 3 to 4 days of allopathy. Okay, so I'm moving on. If you like to have any doubt, any point, please feel free to raise. A discussion always helps. And what the doctor previously raised about this thing, okay, we do keep an open mind. Okay, you might find, you can see you also look into your practice to see whether merksol in all cases you are getting increased salivation or not. You please verify that, and if there is, if you find something different to what I've said, please get back to me and share back with me. Okay, this is a lady. She was on antibiotics while in the Middle East for upper respiratory tract for the last 7 days. Again, we are seeing the effect of the allopathic medicine. So for the upper respiratory tract infection, she was on antibiotic for the last 7 days. She just landed last year. She had severe cough. So while in the Middle East, she went along with the UK, she had a severe cough, and that was diagnosed as allergic. And last evening, that is when she landed, she just has a mild cough. So I gave her Silesia 30, which was a constitutional remedy. So this is what I usually do. When patients are out, after allopathic medicines, they come back and usually they are not, they have some symptoms lingering. And if I don't find anything, indication for anything else, I usually give their constitutional medicine. So I gave her the constitutional medicine last night. I asked her to take her constitutional medicine last night. Today. So this Silesia 30 went in on 16/7/24 night. Now she's reporting on 17/7/24 9 a.m. She's saying now the cough is really bad. And there is much aggravation during sleep, and it is better after waking up. So here, what I did, I gave her Calcarea Carb 200. On what basis? I did a repertoire, what is available to me. the cough is, I have to prescribe because the cough is very bad. And this cough is aggravation during sleep. So I took a repertorial reference of cough aggravation during sleep. And then I did a remedy relationship study. So first we will take up the rubric cough aggravation during sleep. Now some of you might think the cough, that is a common symptom, but I will later on I will tell you. Just in short, I will tell you in my practice what I do with people just come with only cough. The first line of my treatment, I would ask them for the modality of the cough. I would of course find out their thermals and thirst. After finding out their thermals and thirst, I will ask for the modality of the cough. Is the cough worse during? I ask them, is it worse during day or only during night or both day and night? According to that, I have sorted out remedies. And from that, I will choose one and give. That is my usual way of thinking. So here, this is sleep during, cough sleep during. So see the remedies. You have calcarea, you have causticum, you have chamomilla, Pomok remedies. And then, so there are so many remedies. So which to choose from? So in such cases, one option you have is to go and see your remedy relationship. Relationship with what? With your constitutional remedy. So here, Silesia is a constitutional, she's still chilly. So these are the remedies. Belladonna calcareica, calcareous nitric acid, graphitis, arsenic, and cough aggravation sleep during a 4-mark remedy is, I found calcareica. So I gave a calcareica. All right. So this is day one. So day one evening, she tells me she has a cough is not better. Her throat pain is worse. A new symptom has come up. A throat pain has come up, which is worse with cold water, and she's thirstless. So what is your totality? So you have a lady who's coughing worse at night. Who throat pain, who's thirstless, who's chilly. Okay. So here I did a repertorial approach. So again, see, I took this common denominating factor. I look for this. I took up this ailments from all those. It was not specifically mentioned by her. And I also again took up this rubric, insidious. Because why? Because the throat pain, these things are coming up very gradually. All her, slowly things are progressing. So this is my repertorial chart. So she's chilly, right? So in my, so the remedies that cover the 4 rubrics are only up till pulsatilla. I hope all are able to see my screen. Right? Only up till pulsatilla. So from this, what do? I will delete all my hot remedies, sulfur, tuber, apis, Conaium, cocculus, I don't know, basilinum, bacillus chili, lactasis, pulsatilla. These are all hot remedies. So I've eliminated that. So I have what? I have to choose between arsenic and mud salt. And here there is no salivation. So I'm not getting that, this thing. I'm not getting that symptom is not there. But just because salivation is not there, should I rule out mud salt? That is my question. So here again, I'm using what? I'm using remedy relationships. And remedy relationships in Silesia, I have this remedy called arsenic. Merxol is not there. And Merxol would be contraindicated also, right? So I have this arsenic which I can decide upon. So let's find out her response to. So until this point, any doubt? So I'm just showing you a different approach. Okay, somebody said hyoscyamus. Yes, okay. Oh, you mean aggravation during sleep? Sorry, I didn't miss that. Hyoscyamus, yes, we can think of hyoscyamus, but Dr. Danya, how I went about this, how I shared with you, because there are a lot of remedies. So I'm sharing with you an option of using your remedy relationship when you know your constitution. And here, please keep in mind, you have to be sure that your constitution is right. In her case, her constitution had benefited her. So I was sure about her constitution. All right. So that is why I'm using remedy relationships here. So you have to be, so that is one caveat you have, that is this rule, this will help only if you're sure about your constitution. So this responses of audio clip, and this will be in Malayalam. So for those,
ചെറുതായിട്ട് ചുമയുണ്ട്, എന്നാലും കുഴപ്പമില്ല.
ഇന്നലെ രാത്രി ഉറങ്ങാനൊക്കെ പറ്റി അല്ലേ?
രാത്രി ഉറങ്ങാൻ പറ്റി. രാത്രി കിടക്കണേ മുന്നേ കുറച്ചു നേരം ചുമയുണ്ടായി. പിന്നെ ഉറങ്ങി കഴിഞ്ഞു പിന്നെ ഇടയിൽ എണീറ്റിരുന്ന അപ്പോഴൊന്നും വലിയ പ്രശ്നം ഉണ്ടായില്ല. രാവിലെ ആണെങ്കിലും കുഴപ്പമുണ്ടായില്ല. രാവിലെ ഉണ്ടായി ഇത്തിരി ഭേദമായിട്ട്.
രാവിലെ എണീറ്റപ്പോ തൊണ്ടവേദന ഇപ്പം കുറച്ചുകൂടെ കുറഞ്ഞിട്ടുണ്ടല്ലേ?
കുറഞ്ഞിട്ടുണ്ട്. മാറിയിട്ടില്ല, കുറഞ്ഞിട്ടുണ്ട്.
അപ്പൊ സിത്താര ഗുളിക കഴിച്ചോണ്ടിരിക്കേ?
3 hourly
3 hourly കഴിച്ചോണ്ടിരിക്കേ. വൈകുന്നേരം
was the audio audible? Were you able to hear it? So I'll just translate for you. So she said her cough, I asked her, she said, she initially, the first part she was a bit vague. Okay, I'm a bit better. So I want to know whether she's really better. So I asked her, did you sleep last night? Because until that point of time, her cough was keeping her awake. Her cough was not allowing her to sleep. So if she's better, that night cough would definitely be better. So I asked her, did you sleep last night? Yes, I slept last night. So that is my confirmation. So that means that patients are definitely better. So here again, you know, what we said earlier, you know, we're just confirming, so that insight into arsenic, it can be sometimes the evolution of symptoms in arsenic can also be slow. And just again to hammer home the point that our remedies are much faster than antibiotics. Just imagine the antibiotics took her 7 days, that is 168 hours to bring the cough down. And we only required 24 hours. So this is like proven remedy option for me. If I see weakness after fever, so usually seen is after allopathic treatment, and sometimes when after our partially similar homeopathic remedies. If there's weakness after fever, my first choice is sepia. If sepia doesn't work, this is given by Dr. Vijayakar. For me, if sepia doesn't work, China is seen to be helped. Moving on, any doubts? Okay. Okay. So now this is a 51-year-old lady who is regularly on my treatment. Her constitution is natural false. So one day morning, on 8th of July morning, 9 a.m., she says she's having a throat pain. It's severe. And why? Because she took a plum last evening. There's no weakness. She's still thirsty. That is her constitutionally, she's chilly and she's thirsty. So the question here is, what is the ailments from in the repertorial? So you only have an ailments from. So what is your ailments from? Old food, I would not agree. She took plum. Plum, sour things, okay. Fruit, yes. It can be sour things or it can be fruit, right? So, given her, she's chilly, thirsty. So, I did not spend much time. What would be a quick remedy in such a case? Illness from fruit, chilly, thirsty. What would be a quick remedy? What remedy comes to your mind? Arsenic, China. Okay, I gave her China, but let us also look into that rubric and see what other remedies come. I gave her China. Root aggravation. Okay, let's take sour. Okay. In sour, you have antimony proton, China, 4 marks. You do not have arsenic, unfortunately. If you want a chili remedies and you want thirsty, you can take Sorana maybe. Ipecac is thirstless. Phosphoric acid is thirstless. Phosphorus is thirsty, but it's only 1 mark. Sepia is thirstless. Antimonium pudum. I really don't know. Antimonium pudum is chilly, but is it thirsty? I'm not sure. So I gave a China. Okay, I'm going to go back to the case. So again, the learning here is, use we our we should be, our familiarity with the repertorial language is an advantage. It will help you with tackling cases. So the next day she calls up and tells me, the throat pain is same, there's no fever, no weakness. So what do we do? So what repertorial references I took was, I took again the 2 ailments from that is commonly there. One is fruits aggravation and damp wet weather aggravation. Okay. I did not take sour specifically because it is only a few number of remedies. So I took one which is more number of remedies rubric. So I'm going to take up I'll show you it on the repertory because this chart is not showing all the remedies. So damp wet weather and fruits aggravation and weather. So now, okay. So I'm going to read out the chili remedies. Huh? Arsenic, China, natrum cord, paratrum, calcarea, dull camera, elapse, murk, sepia. But patient is thirsty. Okay. So many remedies. So what will you do? So here, I was thinking again. So this patient had only throat pain, right? And nothing else. No weakness. I cannot give a natron force because there is a specific ailments from. It started off taking plum, and she's febrile. Or even after day 2, nothing further is developing. So it's it's not like the throat pain is becoming more. There is more symptoms coming up. It is just remaining throat pain, and she wants that to be treated. So in this case, I gave her dull camera 200. So I'm not going to right now. I'm just not going to justify dull camera. I'll tell you why I gave dull camera. So we'll just move on to one more case. This is a boy living in Bangalore. Okay. The patient is on regular treatment for asthmatic bronchitis. Sorry for the spelling mistake. With sulfur iodide as is constitutional. Today is complaining of throat pain. So one day morning, his mother calls him saying he's having throat pain since morning. Why? Because when playing tennis last, so I said, what happened last evening? So he was playing tennis last evening, suddenly the rains came. Now, what is that? Now, our exercise is how are you going to convert this into repertorial language? Okay, now tell me. When playing tennis, suddenly rains came. So let us see, what is the repertorial language? What is your Ihma's power? So last evening, when playing tennis, suddenly the rains came. One option is wet getting. No, he did not get wet. The rains came. Okay, I'll clarify. He did not get wet. He moved into a shelter and stood. So, sorry, I'll clarify. So, while playing tennis, the rains came. So, he just moved into a shelter and he stood there. That's all. He did not get wet. So, if you want, you can revise your approach. Perspiration suppressed, right? Change in weather, okay? Anything else? Ailments from physical exertion. Okay. So shall we just sort this out? So we have bed getting. Okay, that okay. We got perspiration suppressed, change in weather, ailments from physical exertion, right? Now it is not perspiration suppressed. Where I apply perspiration suppressed is when they say, no, yesterday he was playing outside, he came back all sweating and he went into an AC room, or he sat under the fan, right under the fan, or before his, he cooled down, he went and had a bath. That to me is perspiration suppressed. Change in weather, I agree. Ailments from physical exertion, I would not agree because he goes to play tennis every day. Every day he does not get this problem. So now change in weather. Let us take up change in weather. Huh? So we're going to take up change in weather. To take up change in weather, you have so many remedies. So many remedies. So what will you do? You can say, okay, if you want to take hot remedies, go ahead, take your hot remedies. You have fluoric acid, you have kali sulf, you have Merck. If you want, you can take Merck as hot remedy. Then you have what? You have sulfur. You have tuberculin. If you look up this remedy, there is something different. So what happened? There's a change in remedy, but so this, sorry, there's a change in the weather, but how did the weather change? He was playing tennis, so there's no rain, right? Suddenly it rained. So the change in weather is sudden. And if you take up sudden, you have only 3 remedies. Dulcamara, mesaenium, phosphorus. And in this case also, I gave Dulcamara. Okay. So I just going to introduce you to Dulcamara. I've used Dulcamara a lot. I have started using Dulcamara this year. Okay. I came across this remedy while I was solving a case which was not responding to remedies, like we solved cases before when we are facing challenges. So this is what I have gathered about Dulcamara. Thermal is most likely hot, but I sorry. Most likely hot, but I have also used in chili subjects also. It can be thirsty or thirstless. The activity axis can be dull or no change. So for me, Dulcamara is indicated. One, I go by the ailments from. So it has sudden change of weather. It also covers warm to cold. So you can think of when is warm to cold, like when in summer, the rains come. And say in Kerala, if in Kerala, during your normal December seasons, when your day is hot, nights are cold, or you're playing outside in the hot sun and you go into an air conditioned room, warm to cold. Cold, wet, damp aggravation as well as damp, rainy, wet aggravation. Wet getting also is applicable. Even if there's a change of temperature from warm to cold, that is, you're going from a warm room to a air conditioned room. Hot days and cold nights, like November to February in Kerala. Cold taking cold, heated after becoming. That would mean like in the summer, you go out, you're playing or you go out walk, you're coming hot, and you take something cold chilled water. I've used this in summer of this year for people who after, like when they're really after going out, they're feeling thirsty, then after perspiring, their body is warm and they take something cold drink and then they develop a problem. I've used this type. Perspiration suppressed. And amylation is dry weather amylation. So in places like Bangalore, so you can have patients from many places. Places like Bangalore, this might not be indicated in November to March. So you can keep that in mind. So, and the repertorial listing. So in both cases, there was throat pain, right? Now, this is why one point, if you look up CM Bogart, he says, every cold settles in eyes, throat, or bladder. So if you take up that boy or that lady, there's no other symptom but throat pain. So the cold settles in the throat. So this is the indication for Dulcamara in the current season. This is Dulcamara mind. I've not been able to clinically appreciate this mind so far, but this is just for your information. So can I move on? How do you find the activity level of the medicines, or how do you find the activity level of medicine? Well, that is by practice only. from the books, you can't find. You can't find. That is by, but from your practice you find. So this is my only new addition. All this, the others are from the access levels from Dr. Vijay Karan. It's not my contribution at all. So dual camera, because I happened to use, I came across, I had to, when I was working out of some cases in this summer of this year, I happened to start using dual camera. Then I got interested and started studying what dual camera is. And I have applied dual camera when there is the activity has become dull, as well as when there is no change in the activity. So that is my experience. So as time goes on, if you people have more experience, we can add further clarification to this. So please feel free to contribute and share. I'm not the master. I'm just sharing with you my experience. So okay, this is the next case. So this is a 6-year-old boy. He is usually shown to me only for febrile illness, which responds to opium. Now I'll just tell you why I give opium in this case. So first time I had to think a lot because opium is rarely in my clinical practice. I rarely come across cases of opium. So I gave this boy, I gave him one remedy, other remedy, but no change. But the father kept on pestering me for the right remedy. And then it clicked me that there is no change in his activity and this fellow does not complain. You ask him, I have no problem. He might be having fever, he might be having anything, no problem. I have no problem. So he has no complaints at all. So that is how I gave him opium. So from then, whenever he comes, I used to give him opium. I will not take the case. I just give him opium and he will get better. But this time when he came, like I said, he is never dull, even with high fever. And he will not have anything to complain of. This time when he came, things were a bit different. So he was complaining. He's got pain, I have pain, I have eye pain. And usually he's hot, now he's thirsty, chilly, thirsty, and dull, and temperature is 108. So let us think, what is the approach you want to take? Repertorization, thermal thirst axis, speed, which approach you want to take? First option, I would always say, go for the thermal thirst axis. If that solves your case, that is the most easiest. You spend least amount of time coming to the right remedy. So shall we take up the thermal thirst axis? Let us try that. So thermal thirst axis is so we want chilly, thirsty, right? Chilly, thirsty. Patient is chilly, thirsty, and dull. We have arsenic, belladonna, muxol, hyoscyamus, naxomica, phosphorus, anything else? Calcarea, China, Eupatorium, Silesia, Maca. Okay. So let us go one by one, right? So we don't have any thirsty, we don't have any indication. So what is, I'm just reading out his case once again. Huh? He has fever 1+, that is 100.8. But myalgia is very strong. Myalgia is ++, and he has eye pain since morning. So do you want to choose? Do you want to choose from any of these 6 remedies? So I'm leaving the first. You can. We have one more section. We have totally 6 + 9, 10, 11 remedies to choose from. So do you want to choose from where? Oh, somebody has already decided, huh? So why do you want to choose Dr. Pauline? Why do you want to choose Eupatorium?
Myalgia is there, and
Okay.
guide pain was also.
There. Okay, fine. Fair enough. So you've given your reasons. Anyone has a different opinion? So this is Eupatorium. So see, simple. You solve the case with your chart. Pick. This case is Eupatorium. Shall we move ahead? Do you want me to stop? Okay, now in this case, it's a 3-year-old boy. Now the patient is coming with what, complaining of loose motion since last evening, followed by fever. Temperature increased to 104 in the night, and there were further loose motions, and then vomiting also started after 12 midnight. Used AC but no covers, although he is chilly. No thirst, profound weakness. Flatus and stool is offensive. So my question here is he hot or chilly? Hot or chilly? Come on. Hot or chilly? Patient, the boy says he's chilly. He's a metronom patient, hot patient. He's saying he's chilly. They used air conditioner. And what is the monsoon? This is a monsoon. Whether they use air conditioner, he did not take any covers. The case is hot. Okay. So this is something you can do to get further info. You can ask, apart from taking photographs of the tongue, you can ask them to touch the head, hand and feet with the back of the hand. And the information is head is cold, hot, feet is cold. So you got one more peculiarity. Further symptoms that are available is morning had a large drink. Now fan is fast, no covers. Okay, that confirms it is hot. Now, see, in this case, what happened? What is the first symptom? Loose motions, no? So yeah, I asked him, mother, so why he got loose motions? She's not able to suddenly recollect anything. So what can you ask? What is the question? What is the question that you can ask? Getting the ailments from us always helpful. No? So what is the question that you can ask? So again, I'm telling you the problem started last evening. The first symptom is loose motions and then fever, then vomiting, loose motions continued at night. So I asked her why. Yeah, you can ask about the food taken. So I asked her about the food taken. So that helped me with the case. I asked her what he had yesterday. So she said, started soon after quail eggs, which he usually has. So although he usually has quail eggs, I decided to take this as an ailment from, because sometimes the egg they were given could have been contaminated, could have been spoiled. She's a working mother, and so there is always a possibility, and it started soon after also. So definitely there's a link. So initially she did not tell me about the quail eggs because the child often takes quail eggs. So she did not think that this is the reason. But I asked her, what food did he take in the evening? That was my first question. So it's a specific question. So now, so what is your approach? So I took your thermal thirst axis, hot, thirsty, dull, fast, and then I also took the ailments from an addition. So then what you have? You have your remedy. So this is simple because fast I gave the patient sulfur. Response the second morning is
ഹലോ
ഹലോ
എങ്ങനെയുണ്ട് മോനെ?
അവനിപ്പൊ പനി വിട്ടിട്ടുണ്ട്. ഇന്ന് രാവിലെ തൊട്ട് അങ്ങനെ പനിക്കണില്ല.
ഇന്നലെ പിന്നെ സോസ് എല്ലാം കൊടുക്കേണ്ട വന്നാ?
ഇല്ല ഒന്നും കൊടുത്തില്ല. പക്ഷെ രാത്രി ഒരു പ്രാവശ്യം എപ്പോഴോ അവന് പോയിട്ടുണ്ട്, ലൂസായിട്ട് പോയിട്ടുണ്ട്. അത് അത്യാവശ്യം ഉണ്ടായിരുന്നു ഡയപ്പറിൽ. രാത്രി സാറിനെ വിളിച്ചു കഴിഞ്ഞിട്ട് അവൻ ഒരു പ്രാവശ്യം കൂടി ഛർദിക്കുകയും വയറിളകുകയും ചെയ്തു.
പാതിരാത്രിക്ക് മുമ്പാ?
അതെ.
പിന്നെ ഇപ്പം ആള് ക്ഷീണം കുറവുണ്ടോ? എങ്ങനെയാ?
ക്ഷീണമുണ്ട്, വേറൊന്നും കഴിക്കുന്നില്ലല്ലോ. ഇപ്പോഴും വേറൊന്നും വേണ്ടാന്ന് പറഞ്ഞേക്കണേ. കട്ടൻ ചായ മാത്രമേ കുടിച്ചിട്ടുള്ളൂ. പനിയില്ല ഇപ്പൊ, അതിന്റെ ഒരു ഉഷാറുണ്ട്.
ചെറിയൊരു വ്യത്യാസം അല്ലേ? ഓക്കെ. മോണിറ്റർ ചെയ്തോണ്ടിരിക്കെ ആൾക്ക് ഞാൻ പറഞ്ഞ പോലെ ഹെവി ഫുഡ് ഒന്നും തുടങ്ങല്ലേ.
ഇല്ല.
ചവരി കാച്ചിയത്, കൂവപ്പൊടി, പൊടിയരിക്കഞ്ഞി അതൊക്കെ തന്നെ കണ്ടിന്യൂ ചെയ്യും. ആപ്പിള് കൊടുക്കാം. എന്നിട്ട് ഉച്ചയ്ക്ക് ഒന്നുകൂടെ അപ്ഡേറ്റ് ചെയ്ത് ആ പിൽസ് കണ്ടിന്യൂ ചെയ്യും കേട്ടോ. വേറെ എക്സ്ട്രാ മരുന്ന് കൊടുക്കാൻ പറഞ്ഞേ.
So in the morning, this is the decision I took because there's a lot of loose motions and vomiting until midnight. After midnight, the child is better. Morning, the weakness has not started picking up. It's not really better, but little better. So I waited, but in the evening, the fever came back mildly with one more loose motions, and I repeated sulfur. So this is a case where I repeated the medicine again. So with that, the boy got better. So here I'm going to make you listen to an audio. And you have to tell me what the case is.
ഇന്നലെ രാത്രി വയറുവേദന തുടങ്ങി അല്ലേ?
ഡിന്നർ കഴിഞ്ഞ് ഒരു 2 മണിക്കൂർ കഴിഞ്ഞ്
വയറുവേദന തുടങ്ങി. ഓക്കെ.
വയറുവേദന തുടങ്ങി. അത് കഴിഞ്ഞിട്ട് ഷീ വോമിറ്റഡ് വൺസ്. എന്നിട്ട് കൊച്ചങ്ങ് ഉറങ്ങിപ്പോയി. അത് കഴിഞ്ഞ് ത്രൂ ഔട്ട് ദ നൈറ്റ് ഷീ വുഡ് വേക്ക് അപ്പ് ഫ്രം സ്ലീപ്പ് ആൻഡ് വോമിറ്റ്.
ഓക്കെ.
That happened around 6 times. We took her to the casualty last night.
Okay.
And അന്നേരം പനിയൊന്നും ഉണ്ടായില്ല. And they gave MSH syrup for vomiting. അത് കുടിച്ചു, ഇച്ചിരി വെള്ളം കുടിച്ച് കൊച്ചുറങ്ങി. പിന്നെ വോമിറ്റിംഗ് ഉണ്ടായിട്ടില്ല. പക്ഷെ രാവിലെ ആയപ്പോ ഷീ ഹാഡ് ക്വൈറ്റ് ഹൈ ഫീവർ, ഒരു 101 ഒക്കെ ഉണ്ടായിരുന്നു. അപ്പോ അത്രയും ഫീവർ ഉള്ള 101 മുകളിൽ ഇച്ചിരി പോയി. അപ്പൊ പിന്നെ ഐ ഗേവ് മറ്റേ ഡോളോ കൊടുത്തു സിറപ്പ്. അതിൽ പിന്നെ പനിയില്ല. പക്ഷെ സ്റ്റമക്ക് ഇടയ്ക്ക് ഒരു ട്രബിള് പറയുന്നുണ്ട്. വോമിറ്റിംഗ് ഇല്ല, എന്നാലും ഒരു വയറിലൊരു അസ്വസ്ഥത പറയുന്നുണ്ട്. പിന്നെ ക്ഷീണാണ് ആൾക്ക്. ഇപ്പൊ ഇച്ചിരി ചെറുതായിട്ട് പനിച്ച് തുടങ്ങണ്ടോ എന്നൊരു സംശയം. ഞാൻ 10:30 ഡോളോ കൊടുത്ത്. അതിൽ പിന്നെ പനിച്ചില്ല, പക്ഷെ ഇപ്പൊ ഒരു ചെറുതായിട്ട് പനി തുടങ്ങണ്ടോ.
എത്ര മണിക്കാ ഡോളോ കൊടുത്തേ?
രാവിലെ 10:30.
ചെറുതായിട്ട് പനിച്ച് തുടങ്ങുന്നുണ്ടോ? ഇന്ന് രാവിലെ ഈ ഡോളോ കൊടുക്കുന്നതിന് മുമ്പേ പനിച്ചപ്പം ഫാൻ വേണ്ടാന്ന് അങ്ങനെ വല്ലതും പറഞ്ഞോ?
ഒന്നും പറയാനില്ല. ആക്ച്വലി ആസ് എ മാറ്റർ ഓഫ് ഫാക്ട് ഷി വാസ് ജസ്റ്റ് ക്രൈങ്. ദാറ്റ്സ് ഓൾ. ഒന്നും വേറൊരു പ്രിഫറൻസ് ഒന്നും പറയുന്നില്ല. ഷി വാസ് നോട്ട് ഈറ്റിംഗ്. മുഖമൊക്കെ ഇങ്ങനെ ചുമന്ന് ഷി വാസ് ജസ്റ്റ് ക്രൈങ്.
സോ ആ സമയത്ത് ഷി വാസ് മോർ ഇറിറ്റേറ്റഡ്, ക്രൈങ്.
അതെ.
Was she asking for water since last night?
Yes, she was very thirsty. ഇന്ന് രാവിലെ she was very thirsty.
Now is she again starting to cry and getting angry or അങ്ങനെ ഇപ്പൊ?
ഇല്ല, ഇപ്പൊ ആൾക്കൊരു തളർച്ചയാ. ഇങ്ങനെ എന്റെ കയ്യിൽ ഇങ്ങനെ വെറുതെ കിടക്കുവാ. പിന്നെ വെള്ളം കുടിക്കണില്ല. ലഞ്ച് കഴിച്ചു. ഒരു 2:30 ആയപ്പോ ഞാൻ ഇച്ചിരി ചോറും മോരൊക്കെ കൊടുത്തപ്പോ അത് കഴിച്ചു. I mean, she didn't want it. I force-fed her a bit because she's not eaten. And വെള്ളം കുടിക്കണില്ല ഒട്ടും. She doesn't feel like drinking water.
മോളുടെ ലിപ്സ് എങ്ങനെയാ, ഡ്രൈ ആയിട്ടല്ലേ ഇരിപ്പുണ്ടോ നോക്കാം?
Not so much.
തണുക്കണമെന്നുണ്ടെന്നൊന്നും പറയുന്നില്ലല്ലോ അല്ലേ?
ഇല്ല പറയുന്നില്ല.
Now she is not irritable, she is just lying on your shoulders അല്ലേ?
Yeah.
പറയാം. Any further tendency to vomit since today?
ഇതുവരെ ഇല്ല. രാവിലെ ഞാൻ MSH കൊടുത്തായിരുന്നു. Like I think around 9 in the morning or 8:30, 9 in the morning. പിന്നെ കൊടുത്തിട്ടില്ല.
Any reason why this should start?
Actually no, because ഞങ്ങൾ പുറത്തുനിന്ന് ഒന്നും കഴിച്ചിട്ടില്ല. എല്ലാം വീട്ടിൽ നിന്നാ കഴിച്ചിട്ടുള്ളൂ. അതുകൊണ്ട് I can't figure out what it could be.
അവിടെയും 2 ദിവസമായിട്ട് നല്ല മഴയായിരിക്കും അല്ലേ?
മഴയായിരുന്നു. പിന്നെ ഇവിടെ ഈച്ച ഇച്ചിരി ഒരു ശല്യമുണ്ട്. ഇനി അതാണോ എന്നൊരു സംശയം. ഹൗസ് ഫ്ലൈസ് ഈ മഴയാവുമ്പോഴേ ഇവിടെ, because it's basically a farm, there are chickens and all kinds of things. അപ്പൊ ഈ മഴയാവുമ്പോ ഈച്ച എങ്ങനെ വീടിന്റെ അകത്ത് കയറി വരും. അതൊരു ശല്യമായിപ്പോ. അതാണോ എന്നൊരു സംശയമുണ്ട്. അതല്ലാതെ she's not eaten anything from outside.
അവിടെയുള്ള മരുന്ന് നോക്കട്ടെ, പറ്റുമോ നോക്കട്ടെ.
So that is the case. Now this is the narration. This is how the patients, sometimes you'll get a patient narrate or how they report the case to you. So what is the case? When you take, so in this, you're not getting the case like, they're giving you the symptoms.
അവളുടെ നെറ്റി, ചീക്ക്, കൈ, കാല്, ഇതൊന്ന് നമ്മുടെ ബാക്ക് ഓഫ് ഹാൻഡ് വെച്ച് തുടങ്ങിയിട്ട് just can you see whether any part is relatively more warm
that is the case.
than the rest?
So here,
or whether
so everything is all mixed up.
Part.
So you'll have to sort it out.
Netti is a little warm.
Okay.
The exercise we can do today is, by the way, those who are not following Malayalam, were they able to follow this case?
Kayu angane thanneya, not warm.
I will just
forehead is a little bit warm.
Tell you what the mother said. They said last evening, so this is one morning report. Last evening, the child had abdominal, the child had a lot of abdominal pain.
Redness on the cheeks.
Yeah, but now no.
Pani is just starting.
Had abdominal pain.
Lethargic.
Then started vomiting at night. Then they took to the casualty because vomiting was really bad.
Very low.
They gave MSET.
No activity.
In the morning, this fever started. I gave Dolo. She was crying at night. Then I asked her about her thirst. She was thirsty at night. But now she's not thirstless. She just wants to be carried. And there is offensive flatness.
Probably because she
the child is
vomited.
weak.
But she's passing very.
This is what the mother is reporting.
Gas.
I see.
Very smelly.
So this is the case. So the symptoms have changed. So thirsty at night, now the child is thirstless. Now the child is not was bit irritable at night. Now the child is not irritable, wants to be carried, and there is offensive flatus. Her usual acute is pulsarilla and the constitutional is calculate iodine. And the repertory system was this. So in this case, again also I gave her.
Message.
Let's bring up the case. This is case of Elsa. I gave her sulfur 200. I gave her sulfur 200. And
Sir, ഒരു ഡൗട്ട് ചോദിച്ചോട്ടെ? ഹലോ.
yes. So here I gave her sulfur 200. She was hot, she was thirstless. Okay. And I gave her sulfur instead of pulsat, although they have the same marks, considering the offensiveness as the redness, because in the Machini Medica, sulfur, these are the hallmarks of sulfur. So that is why I chose sulfur over pulsat. And the response is this. This is the WhatsApp of the patient. So this is, I instruct the patient to take SU 200. They already have the medicine marked as sulfur 200. How is she? I asked. So after the day after they are just 22nd I gave sulfur, 23rd there was no reply. So 24th I asked her how she is. Then she is much better. Appetite is also getting better. So that is sulfur. Now I am going to show you a very unusual approach. Okay. So far, any doubts? Watch is still playing. Okay. Sorry about that. Now, this is again a case of my son. So one day, this is the second day of his second day after starting his new school this academic year. Okay. So second day, he comes back from school saying he has a lot of itching. The reason is he's saying that when he on the way back from school in the school bus, he drank water which tasted of chlorine. That day I did not give him any remedy. The next day, the itching began to increase and there was a lot of articarial wheals, really bad wheals. So that day I was very busy with a lot of other work as well as clinic. I was very busy. I did not really pay much attention to him. And I gave one remedy after the other. I gave Apis, Rustox, which made no difference. By the afternoon, he also began to feel weak. So day 2 afternoon, by evening, things were getting even worse. Because by evening, he said he's not able to pass urine and there is pain in his scrotum. Apart from that, there's a choking sensation in the throat. Now, at this point, what is your understanding? What is happening in this case? Are we dealing with urticaria or something else? Are we reading with an allergic reaction or something else? Because it's quite late, I'm going ahead. So my reading at this point is that probably, this is going into a kind of anaphylaxis where, his internal, the allergy is going internally, affecting his urinary tract as well as his throat. So by the day to bedtime, second day bedtime, he has the right scrotal pain. He has not passed urine since morning. The choking in the throat is bad. He's quite tired. He has dryness of lips. He's thirstless. He wants AC at 25, fan at 2, and no covers. So I spent some time analyzing his case and gave him lycopodium 30 at bedtime. Okay. Next day, morning after waking, he's saying his throat is choking, his throat is better. His right testicular pain is better. He's getting an urge to urinate, but no urine yet. So I wait. Day 3 afternoon, I gave lycopodium 200 and there is still no urine. By evening, no urine yet. So what will you do? This is maybe a child or maybe this is a case in front of you. Here, I called two people. One is my classmate who is now a gynecologist to understand what is happening. So he said, if there is no urine for 24 hours, then, probably renal involvement has to be suspected. Fine. So I left it there and then I called up a colleague of mine who's also a homeopath. So he said, we will prescribe something and see. So I gave him the case. He said, you give phosphorus 0/1. Before I could give him phosphorus 0/1, he passed you. So I waited. So this is day 3. Day 4 was okay. He passed urine. There was relatively better, but not totally okay. Day 5, Day 5, the itching started increasing. There were no papules on his inner thigh. The choking in the throat, which was better, has become worse today, this morning. Today, the urinary problem is still there. He's passing a little bit, but there's a lot of pain. He's subjectively weak. So I gave him phosphorus 0/1. After giving phosphorus, there was no amyloidin, and further complications developed. There was a severe cough. He developed very severe cough, for which I gave R-Sided as per my colleagues' advice. After giving R-Sided, the cough came down, but soon developed severe headache with sensitivity to light. Along with that, urticaria and urinary symptoms were persisting. Day 6 status is whatever he had yesterday. There are painful urination, the headache, everything is there. And during that day, later on, he developed restlessness plus pain and numbness of right arm. So things were getting very bizarre, So many symptoms are coming. If you're having right numbness, arm pain, things were getting really confusing. So I took him to a pediatrician. I also did a urine test. Urine test showed nothing. There's no WBC top in the urine. So I took him to a pediatrician. The pediatrician looked up the checked him, examined his testes. He also looked up the report. So diagnosis is allergy, and the pediatrician said, I can't explain the numbness nor the urinary symptom. Now it is almost a week since the problem started. Now the question here is, what do we do? So by day 6, this is the situation. What do we do? So the pediatrician has prescribed steroids and antihistamines. Do we give that, or do we give our medicine? So here, I again had a consultation with my colleague. Now, what is striking in this case? Now, this is what is the diagnosis? Diagnosis is allergy that the pediatrician has confirmed. And in an allergic case, you are having so many symptoms. And he said, I cannot explain the right arm numbness nor the urinary pain. So that is a strong what concomitant in a case of urticaria. So, but how are you going to get your remedy? So here, now when did this start? This started the second day after going to the new school. So here, so none of your approaches is going to work. You have, we have to, because lycopodium was also given on the repertorial approach. The thermal thrust axis is not working. That is not applicable. I asked him for his ailments from. So ailments from coming to the ailments from, prior to going to this new school, he had an apprehension whether he will be accepted, whether he will get friends, etc., etc. But day 1 itself, he was able to make friends. So I asked him about it, he was quite happy. So that was not on my mind strongly. Even then, what this colleague of mine, he took up a rubric called Delusion Friendless He Is. So this is, I'm just showing this, this I'm sharing with you. Just this case I'm sharing with you. This is a bit complicated case. I'm sharing with you to illustrate 2 things. One is that we have many options to deal with cases no matter how difficult they are. Okay. And the second thing is, sometimes we have to think really out of the box to solve a case at hand. So here, the remedy, the rubric taken was this. Delusion friendless that he is. Now there are so many remedies, or a few remedies. Okay. Now, I also share with you the concept behind this. So the reasoning was, he already had this thought prior to going to school that, whether he'll get friends, whether he'll make friends. He was very apprehensive about that. And the first manifestation is on the skin. Now, there is a theory called the theory of conflicts. Okay. And that is by one doctor called Hammer. Now, what he says, I will show you. Now, this in skin has 2 layers. So one is your dermis, and that is underlying, and on top of your dermis is your epidermis. And urticaria is on the epidermis, not dermis. Okay. So there is a theory of conflict which says epidermis. Okay, yeah, I'm coming to epidermis. The conflict is of epidermis is related to epidermis is a separation conflict experienced as a loss of physical contact. So it's a separation conflict. So separation from something, you know, like, so the reason here was in this old school, he had a lot of friends. So there is a separation from those, and so that was the reason. So what was he separated from? So we are thinking how the colleague reason is. So skin means a separation conflict. On the epidermis means a separation. So what is happening when you go to a new school? Reason when in new school, obviously you would not have the new school. You have to make new friends. So you have been separated from your old friends and you're going to a new place. So it is from that reasoning, he chose the rubric delusion, friendless, and then he took the concomitant, the skin case with a strong urinary concomitant, and he chose the remedy Sarsaparilla. With Sarsaparilla 1 dose, 6 days of problem went away. So this is just an illustration of, various options we have with, with the tools of repertory, materia medica. So in today's session, we have seen use of materia medica in addition, materia medica, use of repertory, use of remedy relationships, and also the last is use of biological conflicts. Usually this approach, the theory of conflicts is usually taken in chronic cases, but here this has become a very peculiar acute case in which that knowledge helped us to solve the case. So he's given Sarsaparilla, I think 2 doses were required. No, 30 was given. After that, I gave him 200. With that, he was completely okay. All right, I think we spent quite a lot of time today. I have actually one more case, but I'm leaving that now. So if you want to have some discussions, we can go ahead. Have you people so far tried to use, this single remedy approach? How are you finding it? Have any one of you tried using the thermal thermostaxis? How are you finding it? Do you have cases? Yes, yes. In most of my cases, I wait for 4 hours, except for the last case I was about to show you. I used 0 bar 1. In that 0 bar 1, when I use 0 bar 1, 0 bar 1 is more faster. 0 bar 1, I wait for 20 minutes. Okay. When I use 200 ml, I wait for 4 hours. That is it. The last case I'm about to show you is when I use 0 bar 1. This month, because clinic was quite heavy with chronic cases as such, preparing 0 bar 1, we didn't have time in the pharmacy. That's why we didn't do it. How did you decide LM? No, basically, see, I would have given LM in many cases. Only thing I did not have time because the practice was the clinic was quite heavy. Takes more time to prepare LM, and the pharmacy person was helping the pharmacy and all. We were the situation was quite tight this month. So I actually do not decide much. If LM is there, we give LM. The advantage of LM, I will tell you once again. Within 20 minutes, you can decide whether the remedy is right or not. For 200 cm, it will take you have to wait at least for 4 hours to decide whether it is right or not. That is the only difference. So if you have LM with you and you have the time, I would suggest you keep LM. You can be faster. LM repetition is one after making the medicine, 5 ml every 5 minutes for 4 times. So that's 20 minutes. After 20 minutes, there's 5% improvement. That means you're on the right track. There will not be a big difference. 5 to 10% improvement, you're on the right track. Then you repeat 2 more doses at 10 minutes interval. Then you see if there's, you will have to just confirm whether there's further improvement. So by the end of 1 hour, you can be sure that you are on the right track or not. If you're on the right track, then every 1 hour later the patient is better. LM repetition chronic case is this. It is a bit long. LM, I have not come. I have not. My experience of LM repetition in chronic cases is quite vast. I mean, saying there is no. I have not been able to come to a specific guideline which I can share with you. But what I generally do is I give 3 doses first. That is HS at bedtime for 3 consecutive days. Then I ask the patient to report back to me. Then I see how the patient is responding. If there is marked improvement, then I do not repeat it. But if there is only marginal improvement, I make it daily HS for 2 weeks. I will ask the patient again to come back to me. If I see a lot of improvement, I sustain it at the same dosage. If I see there's again only not much of improvement, but marginal improvement, then I'll increase the dosage. So the principle I follow is, if the improvement is very good, I will either stop the remedy or I will sustain the dosage. If the improvement is only slow or marginal, I will keep on increasing the dosage until there is good improvement. Once I reach a good improvement level, I sustain the dosage. I do not keep on increasing it unless it is called for. That is my general guideline. Yeah, sorry, I also took a lot of time today. Sorry for that. So if you have doubts, I think through Syad or Dr. Rajesh, you can always just share and get back, and we can. I'll help you to the extent possible in clarifying your doubts. If you have difficulties in implementing this in practice.
Okay, Doctor, നമുക്ക് കൺക്ലൂഡ് കുറച്ച് വൈകിപ്പോയി. ഓട്ടോ താങ്ക്സ് ഉണ്ട് ഡോക്ടർ ഐശ്വര്യ ഷെറി. ഡോക്ടർ ഐശ്വര്യ. Dr. Aishwarya, are you there? Hello, Dr. Aishwarya.
രാജേഷ് ഡോക്ടർ തന്നെ വോട്ട് ഓഫ് താങ്ക്സ് കൊടുത്തിട്ട് നമുക്ക് കൺക്ലൂഡ് ചെയ്യാം, ഡിസ്കസ് ചെയ്യാം.
ഓക്കെ സർ. ഡോക്ടറുടെ ഇത്ര വിലപ്പെട്ട സമയം നിങ്ങൾക്ക് വേണ്ടി ചെലവഴിച്ചതിന് ISK നോർത്ത് ഓറിന്റെ പേര് പ്രത്യേകം നന്ദി പറയുന്നു. ഈ വെബിനാർ എല്ലാവർക്കും ഉപകാരപ്പെട്ടെന്ന് കരുതുന്നു. ഇത്രയും ചുരുങ്ങിയ സമയം കൊണ്ട് കുറെ കാര്യം അദ്ദേഹം നമുക്ക് വിശദീകരിച്ചു തന്നിട്ടുണ്ട്. അപ്പൊ ഇതിൽ പങ്കെടുത്ത എല്ലാവർക്കും നന്ദി. താങ്ക് യു.